Welcome back to Great Day Houston. Beautiful shot of the medical center out there. Imagine foot pain so bad that even laying a blanket over your foot is excruciating. Neurologist Dr. Jimmy Ninh has developed a safe, non-surgical method to relieve this kind of pain. Please welcome him to the show along with his patient, Tina Wiley. Hello.
Hello.
Okay, Tina, I described foot pain so bad that even laying a blanket on top was excruciating.
Yes, it is. Very excruciating.
Now, was this something that came on slowly or just out of the blue?
Well, I was diagnosed with diabetes in 2000. And maybe about 2 years later, I kept having pain in my foot. And I would go to my neurologist, and he did a test.
Yeah.
And found out I had neuropathy. So I've been suffering with neuropathy about 9 years.
9 years, and that's debilitating. Like you don't.
Yes.
Obviously, if a blanket hurts, you don't even want to get up and walk.
No.
Okay.
I was immobile in a scooter for a little while. Some places I go on a scooter, but I'm a fighting person, and I believe in my faith.
Yeah.
That I was like, no, I'm not giving up.
And Dr. Ninh, it must be very frustrating because a lot of times if people lose the use of their legs, it's because their muscles just won't work. Well, the muscles worked. It's just that it was too painful to walk.
Absolutely. Neuropathy is very debilitating. And you're exactly right. It's extremely frustrating, both as a patient and as a physician. As a physician, the patients come in and you try to help them and you give them medications and they come back and they say, well, it didn't really help. And for the patients, they have good use of their muscles, but it hurts too much to use it.
Yeah, what is neuropathy? What does that do?
So neuropathy is basically a disease of your nerves, and your body is like a computer. And the nerves transmit all of the information about the outside world to your brain. So with neuropathy, basically what happens is your nerves are dysfunctional, and when you're feeling something which is comfortable, it tells your brain, this hurts.
Yeah.
There's numbness and tingling here. There's pins and needles and eggshells, when all you're doing is just sitting there.
Yeah, and you mentioned the medicine. The problem is with the medicine, you can't like just take medicine and say, just affect the feet, right?
Exactly right. So these medications that we use, they use seizure medications. You've probably heard of Neurontin and Lyrica. They have some limited use, but the problem with that is that they have side effects. It affects all the nerves in your body, including your brain. So a lot of my patients complain of getting dizziness, being tired, and just general grogginess and slowness.
Yeah, so a new combination of treatment, though. What's great about this, and I think with medicine, it's like if you can, less trauma to the body, the better. So you're not cutting open a foot.
Absolutely.
And digging in, right? Instead, show us here, because you have an example of what you're combining and what that actually can do that's effective.
So this is actually a combination therapy. Anytime you use two different modalities to treat a symptom, you're going to get better results. So what we do is we use a combination of therapy called electrical stimulation therapy. And what this is actually a combination of taking Eastern medicine and modernizing it a little bit. This is kind of a suction cup which helps bring blood and nutrients to the surface, and it also has a little bit of electricity which kind of tickles your nerves.
Yeah.
And
so it increases blood flow?
Yes, it can increase blood flow, and you're also stimulating your nerves, and this is used in conjunction with what we call a nerve block. So we administer local medication to numb the nerve, and then we apply this on top, and what that does is it teaches your nerves, it kind of resets everything like a computer. It turns it off, shuts it back on, and it blocks the pain. And the best part about this is it's non-surgical. You don't have the systemic side effects. The patients don't get drowsy, they don't get lethargic. It's great, and it works well. That's the best thing is my patients come in and they are happy.
She's nodding her head and she's smiling over here. Like she said, she was not going to give up. So not everybody does this, obviously.
No, this is being brought to the forefront. What we're finding is that traditional medications just don't work that great. And you get the patients, they come back and again, and they just refill the medications. And
the medication is not taking care of the problem.
It's
just
not
kind
helping.
Blocking the problem.
No.
All right, so when you heard about this, did you think that something like this, which is relatively simple in the explanation, because again, we still think it's all about medicines and surgery, did you think that this is going to work?
I didn't know what it was. I just saw the commercial about neuropathy.
Yeah, you said, that's me.
I had been praying for 9 years. I'm like, God, is this it? So I went, and the staff and the doctors are so compassionate, so nice, and they started doing these procedures, and oh my God, I'm doing things that I had never been able to do in 9 years.
Yeah.
And I can't help but to thank God and the doctors. I'm like, I feel so good now. I've got to, well, I think I'm getting ahead of myself. You have a picture I'm being able to. I couldn't wash dishes without a chair or cook or go to my
you love to
grandchildren's
dance, we
birthday
heard you
parties.
love to
And I
dance.
was always little and I didn't put on all this weight.
Well, you
from-
mentioned something that you had type 2 diabetes, and this is kind of
Right.
thing where things get compounded because
Yes.
obviously if you tried to lose weight by working out or
Yes.
walking, you couldn't do it because your
Right.
feet were too painful.
That's
so now
right.
you can address those issues
Yes,
too.
yes. And they are so good. I'm like, all the things I couldn't do now, I'm like, my son's right there. He didn't want to come up here with me. But I'm like,
But you know, you have your mom
I
back.
was
Just nod your
dancing.
head. You have your mom back, don't you?
yes,
Yeah.
because he would mostly push me in the chair. And,
I think we're about to get an amen.
yes, amen.
All right, so is this something that once you do it, it's done, or is it something she'll come back for, you know, periodically?
So it varies for everybody. So not all patients with neuropathy are going to be candidates for this, but most patients will be. And depending on the severity, it can last anywhere from 6 months to years. Some of the patients just don't come back, which is good news.
Yeah, yeah.
So it depends on every case, but it can last for quite a while. And
Tina, how long has that lasted for you so far?
So far, it's been like, what, a couple of months?
yeah.
Awesome.
And I feel good.
I feel good.
I feel
like I knew
good.
that I would now, right? All right. Well, thank you very much for your testimony. Thank you very much for telling us about this. I know there are a lot of people out there who are saying this is, just like Tina, this is what I've been waiting for. To learn more about the new non-surgical treatments for neuropathy, you can call the Spine and Osteoarthritis Center of Texas at 800-819-6111, 800-819-6111, or find them online at soatx.com, soatx.com. And just like the title of the place says, I mean, basically, you treat all kinds of things that will deal with nerves and arthritis and all that type
We
of
have
stuff.
a big team of pain specialists, physical therapists, and myself. We aim to take care of our patients, and we use multiple modalities. We get it done.
All right, thank you very much.
Thank you.